Thanks, Governor. Looking back at what you've said about the data and metrics that you've said throughout the past weeks that you're basing your decisions on, first it was a 6-region point system, then it was county-level data, and you said you were only reopening places that were trending downward. Now you acknowledge you're reopening all counties in spite of increasing virus activity, and now you're saying it's about the number of ventilators and ICU beds. How can you assure Iowans who might be confused about all that you're really basing your decisions about reopening on data that will best protect their health?
Well, I think I've been very clear that we've looked at it from a 3-phased approach. Stabilization, so we started there because we didn't know from early reports how many Iowans would get COVID-19, the severity of it, how many would be hospitalized, and we really didn't know for sure the capacity of our hospital systems to deal with a unknown pandemic. And so in the stabilization phase, the goal was to protect the health of Iowans, to manage our healthcare resources, to flatten the curve and not overwhelm the healthcare systems. So we put mitigation efforts in place to do exactly that. And those targeted mitigation efforts, because remember, throughout this all, nearly 80% of Iowans remained working and in the workforce, and our businesses were going because they were essential businesses. So the time that bought us with the targeted mitigation efforts allowed us to understand the number of vents and the number of hospital beds, ICUs that we had statewide and within the 6 regions. And we have demonstrated on a daily basis as we moved from mitigation to containing and managing that we have sufficient resources to not overwhelm our hospital systems and to make sure that we could we still had the capacity in case we did see some type of a surge. So we're able to monitor the data and demonstrate that we've met that criteria. So now, as we begin to manage and contain virus activity with testing, with robust case investigation and contact tracing, by working with our facilities and with Iowans, we are able to collect the data and monitor virus activity. We are seeing our hospitalizations stabilize. We're seeing our positivity rate go down. We are seeing the number of cases start to decline, and we can watch that. Even where we're seeing some areas of increased activity, if you look at it, most of the times it's because we've proactively and strategically gone into that area to do some very aggressive testing based on maybe a long-term care facility or a manufacturing or a processing plant. So, it changes daily. We learn more daily. We're gathering more information on a daily basis so that we can make the decisions to continue to reopen Iowa to get not only to bring our economy back, but to make sure that we're doing it in a safe and responsible way. So thank you for the question. We're going to continue to monitor this very carefully. And again, I have confidence in Iowans and our businesses. They are being very thoughtful and responsible when they bring their businesses back online. We're seeing it. Our businesses that have had the chance to come on and talk to Iowans have certainly seen that too. So keep doing the great things that you're doing, Iowans, and we're going to keep Iowa moving forward. So thank you very much.